FMG exam question recall session organized by the Medway. So in this session, I will discuss about some of the recall questions from FMG exam which was conducted yesterday on the 6th July, and I will recall some of the physiology questions which appeared in the exam on the basis of the recall from various sources. So coming to the first question here, the formula UV upon P represents which renal function? So in this slide or in this question, we have to understand what is the meaning of UV upon P. U is the concentration of substance So U means the concentration of substance in the urine, X, and the P is V is the flow of the urine, and divided by the P is concentration of the substance in the plasma. So this formula is used to calculate the renal clearance. The clearance of any substance. C means the clearance of any substance, and X is what? The substance. Of substance, any substance X. So answer here is the D, that is the clearance. Then what about the filtration fraction? The filtration fraction is the ratio of, so FF, this is the ratio of the GFR divided by the renal plasma flow multiplied by 100. So by this way, we calculate the filtration fraction. So in this question, the correct answer is the renal clearance. Then another question here is, the oxygen sensitive channels in peripheral chemoreceptors are which of the following ions? So here we have to tell about the peripheral chemoreceptors. So peripheral chemoreceptors, the short form I will use here, the PCR. PCR means peripheral chemoreceptors. So these peripheral chemoreceptors, they are, one is the carotid bodies, and the other one is the aortic body. These carotid bodies and aortic bodies, they have the global cell. Type 1 glomer cells, there are the oxygen sensitive potassium channels. They are oxygen sensitive potassium channels. So these potassium channels, they are sensitive to the oxygen, and these potassium channels, since they are sensitive to the oxygen, so they will respond to the hypoxia. Hypoxia means the lack of oxygen at the tissue level. So now come to this, the option here. One is the A is option potassium, B is option sodium, then the chloride and the bicarbonate. So our correct answer is A, that is the potassium channel. So remember, the type 1 glomer cells which are present in the carotid bodies and aortic bodies, which are the peripheral chemoreceptors, they have the oxygen sensitive potassium channels. Then the third question is, which of the following is true regarding the increase in the GFR? So increase in the GFR, so we have to know about the increase in the GFR. What are the factors which will increase the GFR? So remember this, whenever there will be increase in the GFR is by whenever there will be increase in the renal blood flow, the GFR will increase. Or you can also say that when the renal blood flow will increase, so then there will be increase in the renal plasma flow also. The second factor which will increase the GFR is afferent arteriole dilation. So dilation of the afferent arteriole, it will increase in the GFR. The third factor is the third factor is the some hormones which will increase the GFR, for example, the dopamine and some other factors also, for example, the cyclic, AMP, they will increase the GFR. Then the fourth is the efferent arteriole. Efferent arteriole restriction. The efferent arteriole restriction, initially it will increase the GFR due to increase in the hydrostatic pressure, right? But later on, it will decrease the GFR. This in GFR will decrease later on because of the decrease in the renal blood flow. So initially, it will increase the GFR due to this GFR will increase due to increase in the hydrostatic pressure, and later the GFR will decrease because of the decrease in renal blood flow. So these are the factors which will increase the GFR, right? Then other thing is also there, that is the fifth is, you can say here, that the decrease in hydrostatic pressure in the Bowman's capsule, it will increase the GFR, or you can also say that increase in the hydrostatic pressure in the glomerular capillary, it will increase the GFR, right? Now let us go to the options here. Increase resistance of the afferent arteriole. The hormone gonadotropin releasing hormone is produced. This gonadotropin releasing hormone, it will act on the anterior pituitary, and from the anterior pituitary, it will act on the gonadotrops, and this it will act on the gonadotrop cells, and these gonadotrop cells, they will produce the hormone LH, and they will produce the hormone FSH, right? So it will act on the target organ. If it is Sertoli cells in the male and the granulosa cells in the female, so these the Leydig cells or Sertoli cells in the male, or if it is the granulosa cells in the female, so they will secrete the hormone inhibin. And what this inhibin will do, this inhibin will act on, so this inhibin will act on the anterior pituitary, and it will act the inhibition of the FSH. So remember this, that the inhibin, it will inhibit the secretion of the hormone FSH. Now come to the option here. So option A is inhibition of FSH secretion. So this is the correct answer here. So inhibin will inhibit the secretion of FSH hormone. FSH means the follicular stimulating hormone. So remember about this. Then come to the next question. The next question is, which of the following is not present in the smooth muscle? So what is not present in the smooth muscle? Remember here, out of this, the myofilament, you know very well about the myofilament. The myofilament, they are of two types. One is the thick myofilament is myosin, and other one is thin. The thin are actin. Then other one is the tropomyosin, and the third one is the troponin. Right, and troponin, they are of three types: troponin T, troponin C, and troponin I. So remember that in the smooth muscle, so this troponin T, C, and I, they are present in the skeletal muscle, they are present in the cardiac muscle, but they are absent in the smooth muscle. So this troponin T, C, and I, they are absent in the smooth muscle. Then where the calcium will bind in the smooth muscle? Because you know very well, the calcium binds with the troponin C in the skeletal muscle and the cardiac muscle. But since in the smooth muscle the troponin is absent, where will the calcium bind? So in the smooth muscle, the so there will be decrease in the heat production by the liver, right? And right, so these are the some of the uh, adaptations when the body temperature will rise. So let us look at the options. So option A is sweating and vasodilation in the skin. This is the correct answer here. The shivering and vasoconstriction, they will start when there is decrease in the body temperature, or it will happen in the winter when our body has to increase the body temperature. So answer here is A, that is sweating and vasodilation in the skin. Right. The increased production by the heat by the liver, it is wrong, because in the liver the heat this heat production will be go down. Then the next question is, what is the typical value of GFR in the adult male? Right. In the adult, the GFR value is 125 ml per minute. Right. And this is equals to 180 liter per day. So any options which is showing the value of 125 ml per minute or 180 liter per day, that is the right answer. Then the next question was, there was a slide of the adrenal gland, and it was asked that the hormone secreted from the slide of the adrenal gland. So I will tell you here that the adrenal gland, it has two parts. That is, the outer part is called as the cortex and inner part is called as the medulla, and this medulla will produce the hormones epinephrine. Epinephrine is also called as what? It is also called as adrenaline, and it will also produce norepinephrine. I am using the right short form, norepinephrine, and the third one will be the dopamine. So epinephrine or the adrenaline, the norepinephrine and the dopamine, they are produced from the medulla, and the cortex, it has the three layers. One is called as zona glomerulosa. Then the second one is called as zona fasciculata. And the third one is the zona reticularis. So these three layers are there. The zona glomerulosa will produce the hormone mineralocorticoid. Example is aldosterone. So zona glomerulosa will produce mineralocorticoid. The example of mineralocorticoid is aldosterone. The fasciculata and reticularis, they both will produce the hormone glucocorticoid and saccharoid. So glucocorticoid, the examples of glucocorticoid is the cortisol, and they will also produce the saccharoid. Right. So these are the hormones produced by the adrenal gland. So whatever the option which is matching the theory part which I have explained, that will be the correct answer. Right. So if the option A is mineralocorticoid, so this will match with the zona glomerulosa. The glucocorticoid, it will match with the zona fasciculata, because zona fasciculata mainly produces glucocorticoid, and small amount of glucocorticoid is secreted by zona reticularis also. The adrenaline gland, it will match with the adrenal medulla, and the androgens which are produced by the zona reticularis and in small amounts by zona fasciculata also. So they will match with the zona reticularis. So I told you this, the correct matching here. So in the exam, which was the correct matching based on this theory part, that will be the correct answer. Then the next question is, here a patient presented to the emergency department with unconscious state and an arterial blood gas analysis was done. The report is given below. The pH is 7.1, right? So pH is 7.1. So this pH is showing what? It is showing the acidosis. Why it is acidosis? Because you know very well, when the pH is less than 7.35, right? So the pH is less than 7.35, this is showing the acidosis. So since the pH is 7.1, it is called as the acidosis, right? Then what are the causes of the acidosis? The causes is there are two types. One may be the respiratory acidosis, other may be the metabolic acidosis. So respiratory acidosis is when the respiratory acidosis is whenever there is increase in the partial pressure of carbon dioxide. The carbon dioxide partial pressure will rise up. Right? How much rise it is? In the arterial blood, the PCO2 is 40 mmHg, and in the venous blood, the PCO2 is 46 mm of Hg. So arterial PCO2 is more than 40, or the venous PCO2 is more than 46, then it will lead to the respiratory acidosis. So since it is showing the arterial blood gas analysis, so when the PCO2 is more than 40 mmHg, so it is more than the 40 mmHg, so it will be what? Respiratory acidosis. And metabolic acidosis is when the bicarbonate level, this is less than 22 milli equivalent per liter. So it will be showing the metabolic acidosis. Now let us find in the options which is favoring. Right. So here the carbon dioxide PCO2 partial pressure of carbon dioxide is 23 mm of Hg. So this PCO2, it has decreased from the normal value. Normal value is arterial is 40, venous is 46. So it is 23. So here there is decrease in the partial pressure of carbon dioxide. So this decrease in the partial pressure of carbon dioxide, it will show what? It will show the respiratory alkalosis. Right? It will show the respiratory alkalosis. But our pH is showing what? The pH is showing acidosis. And the bike, so this carbon dioxide is not favoring the acidosis. And the PO2 is 98. So the partial pressure of oxygen in the arterial blood is 98 to 100, which is normal. This value is normal. And the bicarbonate is 16. Right. So bicarbonate 16 means this is less than 22 milli equivalent per liter. Means it is showing what? It is showing the metabolic acidosis. Right. So we are finding here what? The pH is showing acidosis, and the PCO2 is showing respiratory alkalosis, and the bicarbonate is showing metabolic acidosis. So which one will select? Respiratory alkalosis will select, or metabolic acidosis will select? So we will select that one which is favoring the pH. The pH is acidosis. So this metabolic acidosis is matching here. So our answer will be what? Our answer is the metabolic acidosis. That is the option A. And this metabolic acidosis, what the respiration is trying to do? The respiration is trying to compensate this metabolic acidosis. So in this, the correct answer is the metabolic acidosis, because the bicarbonate level is less than the 22 milliequivalent per liter. Then the next question is the characteristic feature of primary hypothyroidism. Remember in this, the hypothyroidism, in the hypothyroidism there is decrease in the T3 level, there is decrease in the T4 level, and since the T3, T4 are less, so what will happen is the thyroid, this anterior pituitary, it will secrete more and more TSH. So TSH level will be more. Why the TSH is more? Because what the anterior pituitary will try to do, it will produce more TSH so that it can act on the thyroid gland and help in production of T3 and T4. But the T3, T4 are less, so the negative feedback effect of T3, T4 will be less. So if you remember this, the feedback mechanism of T3, T4, so the hypothalamus, it will produce the hormone TRH, This hormone TRH, it will act on the anterior pituitary. It will act on the anterior pituitary, and the anterior pituitary, the thyrotrophs cells are there. These thyrotrophs, they will produce what? It will produce the hormone TSH, and this TSH will act on whom? It will act on the thyroid gland and help in the production of T3 and T4. But since the T3, T4 is less, and what this T3, T4 do? This T3, T4, it will exert the negative feedback mechanism on the anterior pituitary as well as on the hypothalamus. But since the T3, T4 is less, so the inhibition negative feedback on the hypothalamus and on the anterior pituitary will be less. So there will be increase in the TSH. So this will be the characteristic feature of primary hypothyroidism. So there will be elevated TSH and low T4 and T3 level. Right. So these were some of the recall questions from the FMG July 2024 exam that was held yesterday, that is on the 6th July. Right. So thank you very much for watching this video. This session was organized by the Medway. So we are thankful to the Medway for organizing this physiology recall session. So thank you very much for watching.